As part of activities to mark International Sign Language Day and Deaf Week, Deaf Women Aloud Initiative, a non-governmental organization, organized a one-day capacity-building workshop for healthcare providers and deaf women in Abuja, Nigeria's capital city. Executive Director Deaf Women Aloud Initiative, Helen Bayoko Alase, in her welcome remarks said most deaf women face barriers while accessing healthcare facilities, as most of these facilities do not have sign language interpreters.
This is a critical issue. As deaf women often face barriers in accessing healthcare services. One of the biggest barriers is communication. Many healthcare providers do not know sign language, which can make it difficult for deaf women to explain their symptoms and understand their treatment options. Another barrier is that many healthcare providers are not aware of the specific needs of deaf women. For example, deaf women may need more time to process information, or they may need written instructions. That is why it's so important to build the capacity of healthcare providers to serve deaf women. This means providing them with training in sign language and deaf culture. It also means making sure that healthcare facilities are accessible to deaf women with features such as virtual alarms and amplified sound systems. In addition to capacity building for healthcare providers, we also need to focus on empowering deaf women to advocate for their own health needs and for their rights. This means providing them with information about their rights and how to access quality health care.
She further said her organization will do a follow-up after the training to see how many healthcare centers will employ sign language interpreters to see more deaf women, especially those who are pregnant, access antenatal facilities.
Our intention is to continue with this training, to follow up, to see how we can measure the success and how accessible such impacts, the results, how accessible the hospitals have become following some of these interventions that we are having. The perceptions, we'll try to measure the negative perception that we used to have before and try to see if there's a change going forward, to have an idea whereby deaf women can easily go to hospitals and possibly more enrollment in antenatal and other services where they get to seek for services. So most times we also advocate for government to recognize some of these needs and pull down to the grassroots also on how we can take up the other states for this intervention and training to go to other states, just like we're just having a pilot here in Abuja. We hope that this will be translated to every other state in Nigeria.
Some of the medical personnel and deaf women share their experiences.
Go to labor room. So I refused and I stayed. So until they came to tell me that baby is coming or I have to go to labor room. So I listened to her. I just followed her to where she wanted me to go. So whatever they're saying, I cannot understand. So I want to lie on the bed. They push me like to sit on a chair. So it was the back and forth because they could not understand me, I could not understand them. So I went back to lie down on the bed. Okay, it was difficult to go through that process because they could not understand me and I could not understand them. Now I'm pregnant again, so I go to the hospital, there is no interpreter. So the nurses are speaking, I cannot hear them. So if I tell them I am deaf, they tell me to wait. So I expect them to remember me that I'm a deaf person that came here before. But they don't remember, so I will just follow number. They don't tell me anything. When they test me, they cannot tell me if I'm fine, if the baby is fine, because I cannot hear them. and they write to me and ask me if I'm taking drugs. I just say yes.
This program is a very nice program. Before now, deaf women and dumb, most at times when they get to the hospital, we have this issue of communicating with them because we don't really know how to talk with them. We don't really know what is their problem. They cannot relate to us and we cannot relate to them. But with this program, we have learned that when they come, there are signs that has been communicated to us, that when they come, we welcome them, make them feel at home, make them feel that they belong, and don't make them feel they are rejected or they are not human beings like others. So when they come and you welcome them properly, smile at them, make them feel welcome, they will be able to relate their problems to you. But before now, many of them, they find it difficult to access health facilities because they don't know how to go about with it. The health workers don't know how to relate with them. The health workers don't know how to communicate with them. Most of the times when they see them as people that are not supposed to be around there. And then their attitude, repels them. Their attitude makes them to feel bad. And you see many of them, when they get to the health facilities and they are not attended well, they feel sad and they leave the place, devastated. So, but now with this program, when they come and they discover that they are welcome, they discover that this is a place where I can access health care, they are happy, and then they will feel free to relate with you. They will feel free to communicate with you, and then they will feel free, even they will confide in you to tell you their problems.
Deaf Women Aloud Initiative is one of the foremost non-governmental organizations campaigning for the rights of deaf women, especially those who are pregnant.